Welcome to Philips Zoom, the #1 patient-requested professional whitening system. We offer a full portfolio of in-office, take-home, and maintenance whitening products to meet all your patients' needs. The Philips Zoom WhiteSpeed in-office system with 6% chairside kit offers professional results in minimal time and is clinically proven to whiten teeth up to 6 shades in as little as 1 hour. We provide your office with everything needed in one comprehensive system, including patient take-home kit. Dentists worldwide are seeing the radiant results of Philips Zoom WhiteSpeed in both their patients and their practices. To help support your team with the whitening procedure, we've created this step-by-step instructional video. We'll begin with initial setup, followed by pre-procedure, prep, post-treatment training, candidate qualification, and patient expectations. We'll then cover cleaning and storage, as well as some tips to help you manage and market your whitening program. To further support your practice, we offer marketing and practice building support, including Philips Zoom materials that can be customized to your specific office and patient needs. To learn more about marketing Philips Zoom to current and potential patients, visit the Marketing and Practice Building Resource Center section on our website. Thank you for choosing Philips Zoom for all of your whitening needs. Now, let's get started. Section 2. Assembly and Setup. Your Philips Zoom WhiteSpeed will arrive partially assembled within the shipping box. Remove the contents for assembly, including the parts bag. Now, attach the casters to the feet of the WhiteSpeed lamp base and lock into place. Next, place the base upright on the floor. Insert the stand into the base by aligning the pin in the stand with the slot in the base. Assemble the lock washer with the big teeth facing each other and place on the bolt, followed by the washer. To secure the stand pole to the base, reach under the base and screw in the bolt. To attach the WhiteSpeed lamp head to the lamp arm, loosen the knobs by the lamp head socket by 4 or 5 turns. Gently but firmly, push the head into the socket and retighten the knobs. Place the arm onto the stand by carefully aligning with the hole in the stand. Remove the screw and Allen wrench from the parts bag and insert the screw into the hole and tighten, using the wrench. We recommend you keep the wrench in a safe place in case you need to disassemble the WhiteSpeed lamp. Once the WhiteSpeed lamp is assembled, connect the electrical cords from the arm to the cords from the stand and the head. The head connector must be turned until you feel it lock into place. Your Philips Zoom WhiteSpeed lamp is now fully assembled and ready for use. Now, review the contents of the Zoom in-office procedure kit to familiarize yourself with the components. Note the kit comes with 2 full patient procedures and 2 patient take-home kits. The Zoom procedural gel is packaged inside the procedure kit. It does not require refrigeration. For maximum results, the Philips Zoom 6% chairside kits are available with 2 different take-home options. Depending on your region, you may choose from a wide variety of formulas for Philips Zoom Day White and Night White. 3 pairs of eyewear are included with the purchase of each Philips Zoom WhiteSpeed. Make sure each participant wears Philips Zoom protective eyewear. If you need more, contact your sales representative. Do not substitute with eyewear supplied for use with lasers or other dental lights. 2 IsoPrep retractors are provided with each Zoom kit. The IsoPrep retractor is necessary to ensure proper positioning of the lamp head and additional protection from the light. The blue universal size will fit the majority of patients. The optional small gray retractor is good to have on hand for special cases. Air and water setup is necessary for the procedure. A surgical suction tip is provided and should be used for gel removal at the end of each session to prevent disturbing the isolation material. Do not use water when removing the gel after each session. Section 3. Pre-treatment consultation. Before starting a ZOOM whitening treatment, you need to determine if the patient is a candidate for the procedure. We recommend you do this in a prior consultation to ensure there are no underlying oral health issues. The consultation is also a good time to prescribe sensitivity protocol. By doing this before the whitening treatment, you ensure a positive patient experience. You want to treat existing dental concerns before offering ZOOM whitening. Patients with active periodontal disease, failing restorations, or other oral health concerns are not good candidates for a whitening procedure. As with other whitening products, this treatment is not recommended for pregnant women or nursing mothers. We also recommend that patients be at least 18 years of age. It is important to set realistic expectations about potential whitening results. Explain that results may vary. However, most people will experience a change of up to 6 shades, depending on their beginning color. Review the patient's shade with them. This helps to show a realistic perspective in terms of dentin shades and helps set appropriate expectations. Additionally, anatomy, genetics, calcifications, age, teeth condition, and oral hygiene determine the results each patient will attain. Patients with yellow or brown staining tend to see the best results. Patients with severe gray, tetracycline, or fluorosis staining will require additional follow-up. This can be done with either additional take-home gel or with further in-office treatment. These patients may experience less dramatic results, but should still see an improvement. Crowns and other tooth-colored restorations will not whiten. To maintain uniform color, tooth-colored restorations may require replacement following whitening. As with most whitening procedures, patients should be informed they may experience mild to short-term teeth sensitivity that will go away within 24 to 48 hours. Patient sensitivity can have an impact on the overall whitening experience. Sensitivity varies greatly within the general population, so it's important to manage expectations accordingly. The new WhiteSpeed lamp is designed to maximize patient comfort. It has variable intensity settings, including low, medium, and high, that allow you to customize treatments based on each patient's individual needs. At the beginning of the procedure, we recommend starting with the highest light setting and adjusting to patient comfort. Patients with a high risk for sensitivity should start on a lower setting. Be advised, lower light settings may not achieve optimal results, and additional sessions may be necessary. Section 4. Pre-procedure and preparation. During the consultation appointment, impressions can be taken for making custom-fitted whitening trays. It's important to emphasize that the Philips ZOOM in-office procedure includes an additional 3 days of take-home treatment for maximum results and to help the patient get their whitest smile. Philips ZOOM offers a variety of whitening accessories as well to help you make proper fitting trays, improve compliance, and provide the best results for each patient. When complete, trays should be placed in the tray case provided in the patient post-care and maintenance kit. Before starting, the patient's enamel should be free of moderate to heavy plaque and calculus buildup. Preferably, pumice teeth just prior to whitening. Patients that require root planing should wait 2 weeks after completing their periodontal treatment before their in-office whitening procedure. Begin by placing the surgical suction tip provided on the high vacuum suction. Apply vitamin E to the patient's lips to moisturize before retraction to increase patient comfort. Then, recline the patient 45 degrees and place the protective eyewear. Adjust the eyewear for proper fit and comfort around the ears. You can give the patient a handheld mirror at this time so they can follow the procedure. Insert the isoprep retractor at an angle, retracting one side at a time, using a dental mirror to assist in placement. Allow the patient to adjust until comfortable, and then instruct them to lightly bite down, applying continuous pressure. The blue universal size will fit most patients, but there is a small gray retractor available if needed for special cases. Additional universal and small retractors can be purchased separately. Take a retracted before photograph using a matched shade guide tab. Let the patient see the shade guide showing them the shade of their teeth prior to whitening. To best assess a patient's whitening results, we recommend you shade match teeth with a value-ordered Vita Classical Bleached Shade Guide. Make sure to document the starting shade in the patient's chart. Section 5. Isolation. Carefully place one face bib around the retractor, one side at a time. Add an additional bib for heavy salivators. Begin isolation by placing cotton rolls in the center of the upper and lower vestibules. If the cotton rolls are too large, unfold the provided gauze and twist in the shape of a cotton roll. Next, isolate with the gauze included in the Philips Zoom procedure kit. Fully open the gauze squares and fold into a triangle. Place the apex of the triangle into the posterior vestibule area. Tuck the balance of the material into the vestibule, tucking ends between the cotton rolls and the retractor. The supplied gauze has been tested and is proven to provide superior protection with the Philips Zoom WhiteSpeed. Do not substitute your own gauze for this procedure. Liquidam is used to completely protect soft tissue. It is important to completely cover all gingival tissues to ensure that no pink tissue is showing or exposed. Twist to remove the cap and attach the metal tip to the Liquidam syringe, making sure it is secure and locked into place. Dry the soft tissue and begin by scalloping the Liquidam barrier material at the CEJ area on the upper teeth, slightly overlapping enamel and interproximal spaces to form an enamel seal. This overlap will not affect results because the Philips Zoom light activated whitening gel penetrates the entire tooth, including the root. Cure the application of the Liquidam on the gingival margin using a curing light. Liquidam is a resin blend that can become warm upon curing, so use a sweeping motion, moving the light back and forth across the arch for about 10 seconds. Now, change to the plastic tip and fill the space between the cotton roll and the line of Liquidam you just created at the margin and cure. Be sure to cover all interproximal areas, leaving no pink soft tissue exposed. On the lower arch, apply Liquidam using the same method. Use the syringe tip to press lightly on application to ensure it's completely cured. The material should be solid and have no give. If necessary, cure the arch again for an additional 5 seconds, utilizing the back and forth sweeping motion. The application of the Liquidam should extend distally at least one tooth beyond the area receiving whitening gel and be about 2 mm thick, with no pink showing. Section 6. The Whitening Procedure. To start, place the Zoom light guide on the Philips Zoom lamp head. Turn the lamp on using the power button located on the side of the power pack. When the light guide is attached, the display will read Guide Status, Guide Attached, followed by 4 of 4 sessions, indicating the remaining sessions available and total sessions available. With one hand, pinch the tube of Whitening Accelerator pH booster firmly at the line until compressed. With your other hand, hold the applicator tube at the base and bend downward until the seal is broken. Gently twist until the handle is detached from the tube. Use the swab at the end of the handle to generously apply the Whitening Accelerator gel to the teeth. Each Whitening Accelerator tube has enough pH booster for 2 15-minute sessions. Remove the cap from the Philips Zoom whitening gel syringe and attach the mixing tip. Now, apply the gel directly from the syringe to the teeth, about 1 to 2 mm thick. Using the brush provided, mix the whitening gel into the pH booster. Align the light guide to the IsoPrep retractor. Place the end of the retractor into the slots located on either side of the light guide. Begin the whitening session by pressing the intensity button and selecting the desired option. You can choose from high, medium, and low light intensity. Start with the highest light setting and adjust to patient comfort. The Philips Zoom Chairside 6% kit will deliver optimal results at the highest setting. Next, press the Start button to turn on the light and activate the session timer. It's normal for the light to flicker for the first few seconds. Press the Pause button if the session must be interrupted at any time. To reactivate the session, press only the Pause button, or the fourth and final 15-minute session will be lost. Let the patient know that the WhiteSpeed lamp will beep once when 3 minutes remain, and that it will beep 3 times just before the session ends. Point out to the patient that the 4 lights on the top of the accelerator head will track the session's progress. A light will appear for each quarter of the session. These lights are also helpful for checking on the patient's progress and time remaining. Be sure to check on the patient regularly during the whitening treatment. If you plan to leave the room for an extended time, provide the patient with a means to contact you, such as a small bell. It's also helpful to have a paper and pen available in case the patient needs to communicate with you. When the time reaches 0, the light will turn off and a long beep will sound. After each 15-minute session, remove the light guide from the retractor and gently pull the WhiteSpeed away from the patient. Avoid changing the angle of the arm or lamp head to minimize readjusting for each session. Next, carefully remove the gel with the surgical suction tip and check the isolation materials to ensure no pink tissue is visible. If the patient notes irritation at the margin, use vitamin E oil to soothe the tissue. If the patient notes tooth sensitivity, you can lower the light intensity on the lamp to medium or low. You can also apply the Relief ACP gel on lingual surfaces for the remaining sessions. Reapply the pH booster and Zoom whitening gel, align the light guide to the IsoPrep retractor, and begin the next session by pressing Start. Repeat these steps for each of the following 3 sessions. With the Chairside 6% kit, you will want to use all 4 sessions to obtain maximum whitening results. Section 7. Isolation Removal. Remove the Philips Zoom light guide from the cheek retractor slots and gently slide the WhiteSpeed lamp out of the way. Use the surgical suction tip to remove gel from the teeth. You must not use water until all of the gel has been removed. Once you are sure all of the gel is gone, use the air-water syringe to moisten the gauze. It's very important to moisten the gauze and cotton rolls before removal to prevent tissue irritation. Grasp the gauze and cotton rolls, then gently pull the material out. All of the isolation materials should pull free from the mouth in one unit. Completely rinse the teeth and irrigate the oral cavity. If liquidam remains interproximally, remove it with floss. Section 8. Post-treatment. Now it's time to assess your patient's whitening results. Reinsert the retractor and take a retracted after photo with the lighter shade tab in place. Measure the shade change by counting the shift according to the shade guide. To reduce the potential for sensitivity, dry the facial surface of the teeth with gauze. At this time, the teeth are dehydrated and may be sensitive to air. Review the post-treatment care instructions with the patient. Explain that the take-home kit will help the patient achieve their maximum whitening results, and they should begin their 3-day take-home treatment immediately following their chairside procedure. Patients should avoid consuming any staining foods or beverages for 2 hours after their treatment until the pellicle reforms. All tooth whitening requires maintenance. Personal habits that promote staining, such as smoking, coffee, or red wine consumption, will affect how long whitening results will last. Once a patient sees how beautiful and white their smile is, they'll want to maintain it. Philips offers many different solutions you can recommend to your patients for ongoing whitening maintenance. Take-home kits are available for Zoom Night White and Zoom Day White in a variety of formulas, suitable for touch-ups, maintenance, or full and extensive treatments. A Zoom pen helps with whitening on the go, and for daily brushing, Philips Sonicare Power toothbrushes help patients maintain their healthy white smiles. To see the full range of formulas available, please visit the whitening section of our website. Section 9. Cleaning and Storage. After each whitening session, remove the light guide and properly dispose of it. Next, the WhiteSpeed accelerator and base stand should be cleaned and disinfected. Use any standard quaternary ammonium, phenolic-based disinfectant, or alcohol to wipe down your unit. Do not spray disinfecting agents directly onto the unit, and do not use glutaraldehyde. Such materials can damage the coating surface. When the unit is off, check the glass in the output window on the WhiteSpeed head to ensure no residue from the cleaning fluid remains and no particles or streaks are visible. Section 10. Tips and Troubleshooting. If the light will not turn on, or if the light guide is not in place, the display will continue to read "Attach Guide." It can be difficult to dispense the liquidam from the metal tip if you use your thumb to depress the plunger. Instead, place the plunger against your palm and pull the barrel with your index and middle fingers. Once the isolation is complete, always check the margins and interproximal coverage of the liquidam, especially on your blind side. Remember to use the rule, no pink. Most patients experience little to no sensitivity with the Philips Zoom 6% chairside procedure. If there is concern about excessive sensitivity and ibuprofen is needed, do not exceed 1,200 milligrams within a 24-hour period. The smallest effective dose should be used.